Just want to say hi and good morning to everyone. I hope you're where you're supposed to be. You're in the SNAP session this morning. Um, I am going to be going through a PowerPoint, and then we will do all questions through the chat function. I will try to keep up with them as I'm going through the PowerPoint, but if not, I'll make sure to get back in touch with everyone afterwards. Again, if you will mute yourself, and then if we have questions later at the end, then we can unmute and start asking those. If you're having an echo, let me know. I see Ursula is having one. Ursula, that may be on your end. If it's on my end, if someone else will go ahead and put in the chat that they're also hearing an echo, and I'll see what I can do on my side. So, but again, good morning, everybody. I'm hoping everyone can see my PowerPoint I have up. And we're going to talk about some different things this morning, everything from kind of what's going on in the world of SNAP these days with COVID. We're also going to talk about a couple of new programs that ETFB has that we would like to invite y'all to be part of it. So let's get started. This first slide, just where y'all have everyone's information and what does the benefits assistance team do? Well, we do application assistance for different state benefit programs, including SNAP, Medicaid, CHIP, Tanf, Healthy Texas Women's, and Medicare Savings Plan. I am the client benefits manager, and then we have 3 client benefits specialists that's on the SNAP team. Melina lives here in the Tyler area. Latanya is down in our Lufkin area working out of DP's Texas Resource Center. And then we have Mary up in our northern area, up in the Pittsburgh area. So if you are thinking you might have questions or need more information about any of the programs we're going to talk about, go ahead and take down my email address and my phone number. If not, we can come back and put the slide back up later where you can get that information. That will be the easiest way to contact me with any questions after this session. Before we get started, let me just quickly ask, does anyone have any questions to start off with? Anything like that? That way, just give us another minute or two to make sure everyone's come into the session. I'm really enjoying seeing some familiar faces that I haven't seen in a while. Before I became manager, I actually worked up in the northern counties with a lot of our agencies doing benefit applications. And it's been a while since I've been out on the road to be able to work with them. So really happy to see y'all. Janet, you just happen to be one that's right there on my screen. So good morning to you from Mercy Mall Equipment. Seeing a lot of friendly faces. I pick out Janet because Janet's in my hometown. So we're going to go on and we're going to quickly talk about the different programs that my team can help your clients with the applications for. Of course, our biggest program that we work with is SNAP, which is food benefits. SNAP provides foods for families, and it also provides benefits that clients can buy garden seeds. So tomato plants, squash plants, those kind of things in the early spring and summer. Those plants and seedlings can be bought with SNAP benefits if they produce food. There are some fruit trees, if it's a true fruit tree that produces fruit, those can also be bought with SNAP benefits. If it's an ornamental fruit tree of some sort, they usually will not pay for those. So let's go on. And then we have the Medicaid and Children's health insurance program. These are going to be insurance or medical programs that help all different kinds of people pay for insurance or provide insurance for them. Medicaid is going to be a program where there's no cost. CHIP typically has, depending on the income of the client, it's on a sliding scale. So they may have to pay, perhaps $5 to go see the doctor. But for those families that can't afford health insurance, this is a great way to make sure that their children stays healthy, especially during this pandemic. But Medicaid will also cover seniors. We do a lot of Medicaid for pregnant women, people with disabilities. We also do Medicaid for families that have a parent that's staying home with a disabled child. If you can't work because you've got to stay home with a disabled child, you may be eligible for Medicaid yourself. Next one is Tanf, is Temporary Assistance for Needy Families. This is the closest thing that Texas gets to what is known as welfare. But in the state of Texas, this program is very limited, and it has the lowest income requirements of any program we deal with. Meaning, when I say lowest income requirements, you can basically have nothing. We see a lot of single moms or single parents raising children who are not working, who may not be receiving child support, and there's absolutely no income coming in. These are the kind of families that we're looking for this program. Also, a grandparent that is raising their grandchildren may be eligible for this program too. So if you've got grandparents, and we see more and more grandparents raising grandkids every day, this may be a great program for them, especially if they get it right before a school year starts, because this money can be used to help pay for things like school supplies and clothing for the kids, that kind of thing. So we don't see as many of these applications. We'd like to see more of them, but these are some of the things that they can use the money for if they're not receiving SNAP. SNAP only pays for food. It doesn't pay for things like toilet paper, paper towels, feminine hygiene products, not paid for with SNAP. TANF monies will cover those. Our next program is a relatively unknown program. It's Healthy Texas Women. This program, Medicaid in Texas was not expanded during the Obama administration when the Affordable Care Act came around. Texas had the opportunity to expand Medicaid to cover a lot of different classifications of families, and they didn't do that. So this is one of the only programs that's available in Texas for females to be able to do yearly well woman exams. This is going to pay for usually just family planning services, your birth control, pregnancy testing, STD testing, those kind of things. It's not going to pay for you to go to the doctor if you have a cough. It's only going to pay for very limited different types of benefits. And then this is my favorite program of everything we do. A lot of times when we walk into one of your agencies and we're talking to one of your senior clients, talking to them about doing SNAP applications, they kind of look at us and they're like, well, we really don't want to mess with this because it's so much paperwork and so much of a headache. We understand that. A paper application is 18 pages front and back, and that is just the very specific part of the application. If you're applying for something like Medicaid or another program, there's a couple of more pages added to it. So that application is very daunting. Now, we don't do many paper applications anymore. The SNAP team here at the food bank, we've gone to trying to do everything online. It makes it a quicker process for our clients. But you know, the application process can be very daunting. And a lot of our seniors pre-COVID were only receiving $15 or $16 in food stamp benefits. This program, the Medicare Savings Program, is a program that if they are receiving Medicare, and yes, I understand when you're doing an application, it gets a little kind of confusing because it talks about Medicaid, but it is for Medicare recipients. If they are having money taken out of their Social Security check every month to pay for Medicare benefits, if they meet the income and asset limit guidelines, that money can be put back into their check. On average, that's $135 to $150 a month. Guys and girls, that is unrestricted money. That money can be used for anything. It's just more money into their check. It doesn't have to be used on food. It can be used to help pay the utilities. It can buy other things needed for the household. It can be used to pay for gas to put in the vehicle. This program is amazing to use to bring your seniors onto the SNAP program. You introduce the Medicare Savings Program, or we refer to it as MSP. The MSP program, tell the client, the senior client, about this program. So not only are they receiving the $150 back into their checks, but also they're going to get the Medicaid, or I'm sorry, the SNAP benefits with it, the $15 or $16, because we do these in conjunction with each other. And so this money goes a lot further than what food stamps would themselves. If you have more questions on this program, or if you've never heard of it, I could talk all day about this program, but I won't get stuck on it. Like I said, I love it. It does great things for our seniors. But if you have questions, of course, I will come back and talk about it a little bit more. PEBT is something new for most of our clients during the pandemic. PEBT, the P stands for pandemic, EBT. This is money strictly for the children. If you are a household of 2 adults with no children in the household, you're not eligible for this money. You have to have children in your household to be eligible. This money is money that was set aside during the pandemic. This summer, PEBT is actually the 3rd round of it that has been done. If your children or children of clients were receiving free or reduced meals at school, that on here it talks about NSLP, that is National School Lunch Program. If they are receiving free or reduced meals from that program, they are automatically eligible for this money. Now, there was a lot of schools that during the pandemic went to or became known as a CEP, or a community eligibility provision school, or a provision 2 school, meaning that they went to all free and reduced meals for all students. A lot of schools went to this. The only thing that makes this a little bit confusing, an elementary school may have gone on this program to feed all of their students, but the high school in the same town may not have. So there are a few eligibility type, or not eligibility, but a few things that you would need to look at as of, is your children going to a school that is giving free and reduced meals? Did you apply for the free and reduced meals? Because now they are actually requiring that you do the paperwork for that program to be eligible. This program, right now, we're looking at the summer PEBT that was for that June through August summer months. This would be to help families. I know it's late for this, but it was to help the families provide meals for the students through the summer. Also, if you had children born after August 1st, 2014, who received SNAP. So these are children that may not be enrolled in school yet. They may be too young for school. They may be 3 or 4 years old. They may be eligible for this program too. There was no application for the summer benefits. If you had already received benefits for last year's school year, then you were automatically eligible for this without having to do any other kind of application. Previously, the amounts for this program are actually determined. It is a one-time benefit amount. So for the summer, each child was getting $375. Now that's not $375 a month, that's a one-time benefit. But for last school year, if your child received for your reduced meals through their school, they were eligible up to about $1,000 a month on average in benefits. So that's not one benefit per family, it's one benefit per child that is eligible. So if you had a family of, say, 5 children, you could range anywhere averaging about $5,000 for that benefit. So it was a lot of help to families that had kids that were at home because the schools had closed due to COVID or other things. This program, right now, they've only extended it through the summer, June through August. If they decide to do it again for the current school year, we probably won't see that come out until the spring. So, but this is something to check with your local school districts. The schools were providing the information for the families. Anything that you have questions on, feel free to reach out to the team. We can help direct with that and help you apply. If you think you might have been eligible for the last year's school year, there still is a way to apply for last year and this summer. They're fixing to close this application process down though. So if you want to check in for your clients or yourself, because this does not matter on the income of the family. If your school was free or reduced meals, no matter what your income, you are eligible for this money. So a few other things that have changed with our programs during COVID. We've had so many changes. A lot of these changes we don't see until the month that they go into effect. We've watched all summer long if they were going to extend EAs, which are emergency allotment amounts, which are the extra amounts. We do know currently that SNAP recipients have been extended for full benefits through the month of September. So, but before I get carried away on that, let's kind of go through each one of these individually because there may be some questions that pop up for this for your clients. So beginning back of April, all SNAP holds received an increase of at least $95 from their normal benefit amount. They were not required to apply for it, to ask for it, nothing like that. They should have had at least an extra $95 added to it. And then on top of that, they will receive a 15% increase to their benefit amount through September. That is some of those EAs, the emergency allotments. So we also have clients coming in saying, when is it time for me to renew my benefits? Because during COVID, there was automatic renewals. Well, those automatic renewals have been extended for 6 months if they were due for a renewal in September, October, or November. Now, if that is extended again, we won't know until probably November. And all of this is going to depend on how COVID plays out in our state. And then also Medicare and everything was extended also they weren't having to do renewals or anything. So coverage for Medicaid recipients will continue during the public health process with no further actions from the Medicaid recipient. If for some reason during this time they are no longer eligible for the Medicaid coverage, they will maybe move to another program, but they will be let know about the change. Also, families who need to renew CHIP benefits. CHIP, remember, is Children's Health Insurance Program. That is the one that's based on a sliding scale fee. Those automatic extensions are coming to an end. So if your client gets notification either through the website, email, on their app on their phone, or a letter in the mail, this is very important that they do their renewal. They can call one of our team members and we can help them with that, because if not, they're going to lose their benefits. Before I move on to the COVID, past the COVID stuff, and start talking about some new programs that we're really trying to kick off here at the food bank, do y'all have any questions? If not, I'm going to scroll through real quick and look at some of the stuff in the chat, see if we've got anything. Let's look at, let's see. Would you come to our pantry and sign up either monthly or bi-monthly? Well, we do come out to pantries and do applications. Currently during COVID, we have brought our team back into a remote situation for their protection and the protection of the community. So we're not going directly to pantries at the moment. We are working a lot from phone. During COVID, there was a waiver granted to us as navigators of the state system, where we can now do applications on GoToMeeting. So basically one of the same formats as what we have now is doing these virtual meetings. We can do applications through that system. We can also do them over the phone. We are doing more paper applications during COVID than what we would normally do, just due to restrictions on face-to-face meetings. Janet, you've got a question about pantries start helping to apply. I've got an exciting new program for that. So give me just a second and we'll get to that. So on to our next one. This is a new program.
Hey, Amanda,
Yes,
Grace has a question. She has her hand up.
Oh, Grace, I'm sorry. I'm not used to looking at hands up.
Just a quick question on Tanf. Does that still have to be paid back? I know many years ago you had to pay it back.
So on Tanf, if say we were talking about a single mom with children at home, if dad is not in the picture and she's not receiving any kind of child support from him, some of the questions in the process of applying for TANF is dad's information. And yes, the Attorney General's office and the state may go after dad to repay these benefits. That can also happen on some of the Medicaid programs too. If dad is just not helping out, support, and take care of his children, he may be asked to repay those benefits to the state. Does that answer your question, Grace?
It does. Okay. I just wasn't for sure because I know years ago it was something. And so, yes, thank you.
That is a possibility. They may have to pay back those benefits. So another program that we have just started here in the during COVID is a referral services program. We call it the RPP program, the Referral Partner Program. And this is a program where we are referring outside services to the client. We know that clients don't need just food. They have so many other needs in their household. And maybe the food that's being provided by their local pantry is not enough to sustain them through the week or through the month even. We know that that's not going to happen. We also know that between SNAP benefits, the food that they're getting at our local pantries, that still may not be enough food. We're referring to other pantries. We're referring for housing and shelter. One of the big ones that people ask for is medical and dental help, utility assistance. All these programs we're keeping in a database. And then as the clients are coming in to do applications, part of our application process is now to ask them, would they like to be part of our referral program? What is so great about this program is it's a 2-year program with quarterly check-ins. We invite the client to be part of the program during their application assist and get a client consent. We have to have that. After we've gotten that client consent, we make a phone call to the client, do an in-depth assessment. And this assessment is not only just asking things like, can you pay your rent? Can you pay your bills? It's also asking the clients, do you feel safe in your home? So, if they need legal services or, there's a landlord dispute, something like that, we try to have services for those that we can refer to them to. So I do the needs assessment with the client. I go through and look at our referrals and provide those referrals to the client. And then every quarter, I make a follow-up phone call with that client and ask them, did the referrals I provide you, were they what you needed? Can I provide you with anything else? Or has your situation changed? It may be now that when we first talked, you were looking for a job. You've now found a job, but maybe now you need help finding clothing that's appropriate for that job. And there I would recommend or refer them to some of our local pantries that have thrift stores that may be aimed at helping with business professional clothing. So after that, again, we go through this every quarter. And then at the end of the first year, they're asked if they would like to continue into a second year. And we've not gotten into the second year at this point because the program is so new. So I'm really excited to see how many people will actually carry over into the second year. But the client also has the ability to withdraw at any time. If they get tired of me calling and asking them, what can I do to help you? Then they can tell me, I don't need this help, withdraw, and then we don't bother them again. So how can you, we went back one. How can you refer a client? Well, we've got some forms we need you to fill out. Most of y'all are familiar with our agency form page on the easttexasfoodbank.org website. Under those forms, there's now a section called Benefits Assistance, and there is an SOA, a Statement of Agreement for the RPP program. You would find that paperwork. You can print it, sign it, and send it back to me. Then we can get you started working in with this program. And then you would refer the clients to me via a form. Again, it's all about the forms. We know that it's all about the forms. And then from there, I would take over and start making those phone calls to the client. You would just refer them. Again, it's not a hard process to do. It's very quick and easy. The main thing is, though, due to Confidentiality, we do have to have that statement of agreement from your agency to work as closely with your clients. Our next program, which is the one Janet was asking about, and what is one of my favorite programs that we do here at the food bank. And some of y'all may be aware of this program. We started it many years ago. It was amazingly effective in our communities, but you know, as funding comes and goes, we had to close it down for a while, but we've got funding again. And so we're ready to open it back up. And this time, instead of us going directly to certain agencies in certain communities, we're asking y'all to reach out to us if this is something you might be interested in. So this program is one that we have developed to help our food insecure communities gain easier access to benefit assistance. So what does that mean for you as an agency? What we're going to do is come in, train your agencies to do these different application assistance. So you could do the SNAP application. You could do the Medicaid application for your clients. And then we would, based on a tier system that is based on the number of clients you serve a month and a goal number of applications that you would do based on those client numbers, we would then incentivize you with food credits to help you with all the hard work you have done. And then, of course, there's always a report due. This is a simple one-page report for this program that basically what you do is tell me, I did so many applications in this county and what programs it was on that application. Was it a SNAP application? Was it Medicaid, Medicare savings program? Any of those. That's how quick and simple this application or the report process is. And then what does this mean though for the communities you serve? I know the extra food credits help with being able to provide more food for your clients. It's going to help with dietary restrictions. If you're not able to afford those, would you now be able to with this extra money? And but it's more about the clients. Our clients are stressed out about transportation, being able to get back and forth to different agencies. You know, they're also stressed. They're stressed about everything. So if they're coming to your agency once or twice a month already to get food benefits, then why not offer them application assistance while they're there through one of your trusted volunteer or trained staff? So it also boosts your local economy. You know, Tim talked earlier during the opening remarks about how many meals a SNAP application equates to. Well, where are those meals coming from? They're coming from your local grocery stores. They're coming from your local even gas stations now, the Dollar General stores. All of these places are EBT, the Lone Star card, which the benefits are put on. They're eligible to use these benefits in those places. And again, it's providing additional funds for your agency to grow your capacity, whether it's with more food. You know, if you took this money and it's in your account and now you have more money to get food from the food bank, you may be able to take money that you would use for that food and apply it to a staff member. Hire a staff member to do this program for you. So I'm fixing to show y'all the tiers about how we would select this based on your size. I see Janet's got a question of, so the money will be put into our food bank account. Yes, it comes as a food credit monthly and goes onto your account. you would look onto your account or your invoices, and it's listed as an auto grant. I see Tim shaking his head yes at me because I had this question for him the other day. But it says an auto grant on your invoices that would show your monthly things. So your report would be due at the first of the month. And then by the 10th of the month, I would submit your food credits to our finance department. And then the finance department adds it on to your agency pantry account. Now, here are the tiers. Some of these look like a little bit of crazy numbers, but let me tell you, we have agencies that are currently working at all different levels of this program. We have bronze level members, we have silver, we have platinum, we have agencies out there that are able to do this. So looking at the top level, if you see 1,000+ households a month, that's a lot of people coming through your doors, and you can do 40 applications. We're going to give you $800 in food credits a month. That $800 could go very far with your food orders, and then it kind of dwindles down as we go down. We have some agencies that may only be open one time a month. They see a very small amount of clients, but they are a huge asset to their community. If they can do as little as 5 applications a month, we're still going to give them $100 in food credits. Now, to be able to, what we ask is you think about it with your agency, talk it over with your staff, volunteers, maybe your board of directors, of where y'all would feel comfortable on this tier level. If you were to say, you know, we see about 250 clients a month, we could do 15 applications a month, and we'll give you $300 in food credits. But say during COVID, you know, some places are seeing a huge increase in clients coming through their doors. Others are seeing a decrease. Say for the month of October, you've had a huge influx of clients coming in, and you have done, the word has gotten out that Grace Nakamura is going to be doing applications. Grace, we've got to talk because you're going to do those. But if Grace had a great month and did 30 applications for that month, as long as we have funding available, and right now, ladies and gentlemen, we have funding available, we're going to give you that higher amount of $500. So another example here. But what happens if it's a slow month? It's Christmas. Nobody's coming in. You're closed for 2 weeks of the month for the holidays, something like that. And you only complete 3 applications for that month. We're not going to kick you off the program. We're not going to refuse to fund you in any way. We're going to fund you at a lower level. But we want you to try to stay at that tier that you set, your goals. That helps us with budgeting our funding to make sure that when someone does knock it out of the park, which we hope every one of y'all knock it out of the park, we would love to be looking for more money for this program than to have a lot of it left over at the end of the year. So if you meet the lower tier, you'll be funded at that amount. So as long as you're doing applications and do at least 5 applications a month, you're going to get food credits from the food bank. So how do you get started with this program? Well, again, there's some forms. These forms are actually found again under that same section under agency forms as the RPP stuff was under. There is an interest form. So this interest form basically asks, who are you? You know, what is your agency? Who's going to be my contact person? And why are you interested in being part of this program? You know, and if you put on there, because we need the money. I completely understand. Everybody needs the extra funds to be able to help more clients. So you would do the interest form. There's a memorandum of agreement. Basically, that's a contract between us at the food bank and you as your agency. And then we ask you to pick a tier. Now, again, that tier can be fluid. We can work with you month to month on that, but we want you to look at what you think would best fit your agency on a monthly basis. Then we have, due to COVID again, we have a recorded training video that goes through the paper application. Why did we choose the paper application versus the online system? Well, the paper application is simpler. It's simpler for the agency to do the application. It's a lot quicker to do this application. Now, does that mean it's the best way to do an application? No. The best way to do an application is going to be online, simply because there's not the lag time between the time the application is completed and the time that it is submitted to the state of Texas. But you would watch this training video. Sorry to say, it is a little bit long at a 2-hour video, and you get to listen to me for those 2 hours. After you and your volunteers have viewed the training video, you would reach back out to me and I would do an individual report training, or if we have several agencies for that month, we may do it as a group. And then I'll answer any questions that you may have about the application or questions about specific questions on the applications. And then if you have any questions about the process, and then it's your time to start completing the applications. If you can get the paperwork to me, if you get the paperwork to me within 2 weeks or possibly sooner, just depending on the time of the month we're looking at, you could be completing applications within 2 weeks. If nothing else, I'd like to see you start completing applications by the end of the next month. If y'all have any questions on that one, feel free to reach out to me. That's the end of my presentation. I'm going to go back through and look at a couple of these questions on the chat. Again, my name, my email, and phone number is there. Reach out to me if you have specific questions about your agency. Vicky at Clausen's asking, so the submissions and household count are looked at basically monthly to determine monthly comp of auto credit, right? Yes, ma'am, they are. When you submit your report into me that month, that report is basically going to tell me how much we're going to fund you for that specific month. If your numbers are low, consistently, say you sign up to be a silver tier and you are consistently, say for 3 months, only meeting the goal for the bronze tier, that lowest tier we have, we may ask you to bump yourself down to that lower tier. Again, it's all about budgeting for us. We need to kind of have an idea generally of what we're going to be spending each month for this program. But if, 2 months later, you start picking up in numbers, if we've got the funds, we can up you back to the next tier. So are the SNAP and Medicaid applications submitted directly to you rather than the state for processing? No, they're not submitted to us. During the training part, we do teach you how to submit the applications. And there's a couple of different ways, whether it's to the state directly, you can fax it in, you can drop it off at your local HHSC, all of that. But I believe we are out of time. So if you have any more questions, yes, you can change the tiers. No problem with that. We are fluid, like I said, with those tier levels, as long as we have funding. And right now is the time to get in on the program because the funding is available and we're unlimited in reaching for our dreams and goals for our clients. All we're trying to do, ladies and gentlemen, is make life a little bit easier for the clients. And in that process, incentivizing you with food credits. So take some time, think about the CAP program, the Community Assistance Partnership, and also that RPP program. If you are on the CAP program, it's very easy to refer your clients over to me for the RPP side of things. So if you have questions, any comments or concerns, please feel free to reach out to me and I'll get back with you as soon as possible. Y'all have a great day and enjoy your next sessions.